Hi, I'm Dr. Jamin Brahmbhatt, and I'm a urologist here at Orlando Health since 2013. Today's taboo topic is men's health. Us dudes don't like talking about men's health. It's the last thing that we want to talk about. Statistics prove it. Men are half as likely to talk to anyone about their medical problems, and men, when they're either having coffee or a beer together, the last thing they're going to talk about is their prostate or any other health concerns. We just don't know when we're supposed to go see a doctor. Women get to see doctors much more often, especially during their birthing years, whereas us dudes just kind of wait until we see a difference in some function in our life or our body, or if someone's dragging us in to see the doctor. The reality is there is a manual to what we should be doing, and that manual is usually set at an early age. And you may have to go see someone every year, every 5 years, every 10 years, but usually if you're by the age of 40, you should be seeing someone every single year. I would say we frequently ignore all health issues, whether it's physical health or mental health. And this is research proven. If you look at the top 10 causes of death here in America, men are more likely to die, a majority of them, compared to our female counterparts. And that's because we wait for these red flags. We actually wait for warning signs. And what we should really be doing is, before that warning sign goes off, going and getting preventative health. The biggest risk of us not addressing our health is we're not gonna live as long as we want to. Men live 5 years less than females right now here in America. That's 5 less years of memories with our grandchildren, 5 less years of vacations, 5 less years of eating your favorite slice of New York pizza. It's 5 less years that you get to live and embrace moments. So who am I supposed to see? A urologist, a cardiologist, a primary care doctor, a nurse practitioner, PA, MD, DO? Listen, guys, the only thing that you have to remember is you should get a manual for your health from a primary care doctor. From there, you and that individual will decide what specialty consultants you need to see. Have a problem with erections? Something they can't handle? You're going to see a urologist. Oh, you've been having chest pain every single night? All right, the primary care doctor should facilitate you seeing a cardiologist. You don't have to think about it. They pretty much do all the thinking for you, but to get to that point, you got to make an appointment. It really comes down to taking that first step. The biggest problem I see with my men is that they have too many things in their mind that are getting them not to go and see the doctor, whether it's they're afraid of my finger or certain exams, or they're worried about the truth. All of these things inhibit them coming in and seeing us. Once you make this appointment, once you get that manual for your health, you're going to see life is going to be so much easier because you don't have to worry about your health. It's all going to be put essentially on autopilot. So we actually did a survey through Orlando Health where we found that men actually care more about their cars and the maintenance on their cars than their actual health. What us guys need to do is we need to treat our body just like we do our own cars or our watches or our most valued possessions. If we realize that all those things can be replaced, but our body can't be replaced, we're going to take much better care of ourselves. And when we take better care of ourselves, we're going to lead healthier, more active lives. After our conversation today, I'm hoping that men's health is no longer a taboo topic. We can freely talk about it at their dinner table. We can freely talk about it at the bar. We can freely talk about it anywhere, because the second we talk about it, we're then more likely to go and actually actively go and seek health. And that's going to cause all guys out there to live better, healthier, active lives. I'm Dr. Jamin Brahmbhatt. I'm a urologist and men's health expert here at Orlando Health, and I thank you for discussing with us today this hopefully no longer taboo topic of men's health.